Sharon, can a mom nurse a premature baby? And from your experience meeting with so many moms, can you talk a little bit about, for a mom who maybe didn't know she was going to be having a premature baby, some of the things they came up against and how to handle breastfeeding in that situation?
Okay, so many things. Oh my gosh, my heart just goes out to moms who have had a premature baby because your life has just taken a turn that you perhaps did not anticipate. A lot of moms feel a sense of grief and loss for that perfect baby they anticipated having. They have a baby that they're very worried about. Many healthcare providers may be in the picture, and there's a lot of new things to try and understand and cope with. For the mom newly in that situation, I strongly recommend that she talk with the healthcare providers, get a hospital-grade breast pump to her as soon as possible, and start pumping her milk. Now, when we say pumping milk, we're talking about little droplets of colostrum that probably don't even cover the bottom of the bottle.
Okay.
And that can be so demoralizing to see that, but understand that those tiny droplets of colostrum really have what your baby needs. It's not about quantity, it is about quality at that point. And if a mom can have the use of a hospital-grade breast pump even after she's discharged, she can be pumping her milk. Think of her pump as a baby substitute and pump her milk, take it to the hospital for her baby. And then hope that everything else is going to go as well as possible while they work their way through that situation.
Now, in general, do moms continue pumping even after the colostrum then becomes actual full breast milk? Is that still
Yes.
beneficial to the premature babies?
It is definitely still beneficial, and in fact studies are indicating that the composition of a mother's milk that she's pumping for a premature baby corresponds to the gestational age of her baby.
That's amazing to
So
me.
it is tailor-made for her situation, for her baby.
Wow.
I would encourage her to get in touch with a lactation consultant who can provide ongoing support. There will be some probably rough days when she's missing her baby, she's worried about her baby, and maybe her milk is not as plentiful as she would like it to be, and working with someone who can deal with the circumstances of her particular situation can be helpful to her.
Now, for moms that their babies are either a little bit further along in gestation when they're delivered, although still premature, or for a mom whose baby, thankfully, is getting to a point that actual breastfeeding at the breast, while still maybe in the hospital, is a possibility. Any suggestions or just kind of heads up about some challenges that they might face because this baby has been introduced to a bottle or maybe even a syringe in some cases?
Right. There are different feeding methods that have to be used depending on the baby's development and ability. So to expect that there will be some transition time before maybe the baby is really nursing while at breast, starting with skin-to-skin contact and the baby on mom's chest.
Okay.
Is a really good place to start, and keeping the baby comfortable there and getting used to what mommy's skin feels like. Those are all tremendous steps to take that will get you further along on the process of having the baby nurse
Probably
at
a
breast.
very rewarding stage too.
Yes.
That probably feels very good.
Mm-hmm.
Now, for a mom who's got a baby premature, is it common for them to talk to you about supplementing with things like formula, or is it an uncommon phenomenon to have to do the supplementing?
I've actually worked with moms in both situations. Overall, they maybe feel a little bit cheated that they didn't get that initial breastfeeding experience, and it becomes very satisfying to them to even be able to pump their milk and feed it to the baby through a syringe. Sometimes we'll have a mom use a syringe. We can get the baby to breast and we supplement a little bit of her own milk or
Okay.
possibly some formula at breast so that the baby's getting the benefit of and the nurturing of nursing at the breast. They're stimulating mom's milk supply a little bit, but they're getting the additional calories that they need as well to play catch up.
So really having the team that is working with your child there to help you.
Absolutely.
How about, that obviously would seem like a good place to start from resources wise. With the lactation groups that you run, Do you find that there are moms in these groups that know other moms with premature babies? I mean, what kind of resources other than just the general, nurses, doctors around that because this has got to be something that's very difficult for a mom to
It's
go
very
through.
difficult. I'm thinking of one mother in particular who came to our group for quite a few months before they moved. Um, she came in, she sat down, and she burst into tears. She felt kind of awkward being in a support group for breastfeeding, that she may have to pull a bottle out and give her son a little bit of what he needed that way. And we encouraged her. I think we became her cheerleading squad. And before they moved, I'm really happy to report that her baby was exclusively breastfeeding and gaining weight, but it took time. So I think patience and support with mom and with baby is very needed.
So really, don't be afraid to reach out to lactation groups or new mommy groups or the leche group. If breastfeeding is something that it may take some time, but it's achievable.
Absolutely. For most babies, it definitely is achievable.
Wonderful. Thank you.